And welcome back to Life Unrehearsed. I'm Matt Delvecchio, specializing in elder care planning and the senior living industry. Thank you for tuning in. I am honored to have as our next guest Dr. Lawrence Rosenberg. Dr. Rosenberg is the president and CEO of CIUSSS West-Central Montreal. Dr. Rosenberg has led the CIUSSS since it came into existence in 2015, and he's held numerous management positions in the Health and Social Services Network, including Director of Surgical Research at McGill, Director of Transplantation at the Montreal General Hospital, and the Director General of the Jewish General Hospital. And he just recently published a book called Patients Matter Most, How Healthcare is Becoming Personal Again. Dr. Rosenberg, welcome to Life Unrehearsed.
Good afternoon.
Well, good afternoon. Thanks for taking some time on a Sunday in your busy schedule. You know, Dr. Rosenberg, there's certainly challenges with our healthcare system, and we hear many stories, whether it's waiting times in emergency or the amount of people on the waiting list to get their own doctor. In a way, the healthcare system has become a bit of a punching bag for the public, and the media has been pretty harsh. A lot of it perhaps is justified. However, I come from a bit of a different angle, and me and my team of senior advisors work with employees and CLSCs and hospitals and rehab centers on a daily basis. And we see that, in general, healthcare workers are hardworking, caring people doing the best they can. So sometimes we do have to give credit where credit is due, and it does start right at the top, Dr. Rosenberg. So on behalf of many listeners and clients that have told the good stories and appreciate the tough environment for healthcare workers, I would like to thank you and your team for all your efforts because it's not easy.
Thank you. Thank you very much.
Now, you recently published a book, as if you didn't already have your hands full. It's called Patients Matter Most, How Healthcare is Becoming Personal Again. This is your first full book as a writer. Why write this book?
You know, we're at a very special time in the evolution of healthcare and healthcare delivery. And after being in the system for almost 38 years now, it seemed to me that with this inflection point that we're at, somebody with a perspective should really sit down and write where we've come from and where we're going and why. And why not me?
And why not you is right. Not too many people will have the experience that you've had. And, you know, it is a bit of a provocative title. Some people may disagree with the statements, patients matter most, or becoming personal again. Some would even claim that's a bit of an oxymoron. But you're the first to admit and acknowledge that we have the most expensive healthcare system, but probably the worst results of all the countries in the OECD, don't we?
Absolutely. So the most recent data from the OECD, which I've seen, which is now a couple of years old, shows that Canada spends more money on healthcare than any of the other OECD countries, which is a list of about 30 Western countries primarily. And we have the worst results to show for it. So specifically, for example, we have the lowest number of doctors per capita, the lowest number of nurses per capita, the lowest number of hospital beds per capita. Our wait times, as you've already alluded to, are really unacceptable in many instances. And throwing more money at this isn't going to solve the problem, clearly, since we're already spending more money than everybody else who are getting better results than we are.
Listening to Life Unrehearsed, Matt Delvecchio here, and I'm talking with Dr. Lawrence Rosenberg, President and CEO of CIUSSS West-Central Montreal. So with that being the facts, Dr. Rosenberg, we're spending a lot of money with not great results. Where does healthcare go from here in Quebec?
Well, you know, it's not just a Quebec problem. It's really a Canadian problem because the Canadian healthcare system really is unique in the Western world. And I say that for a couple of reasons. One is because our system is ostensibly virtually all publicly funded, which may come as a surprise to you, is not the case in the rest of the Western world. Just about every other country has a hybrid healthcare system that is partly public funded, partly privately funded. And those systems are doing a lot better than we are. The second factor, which makes Canada, of course, including Quebec, somewhat unique, is that in most of the other countries of the West, doctors are, for the most part, employees of their systems. even in the United States, which everybody looks to as sort of the bastion of capitalist medicine, almost 90% of physicians are employees, not independent agents, whereas in Canada, virtually 100% of doctors are independent agents. So think about this. We have a publicly funded healthcare system with physicians who are the primary drivers of cost, all functioning as private operators, private agents within the publicly funded system. It makes it very difficult to be able to produce a coherent product.
You know, in your book, Dr. Rosenberg, you do address on a couple of occasions the advancements in technology, and based on what we're describing, and you know, we're already throwing a ton of money at it. We probably still have to throw a lot more, but technology will obviously play an increasing role with helping patients. And in fact, as we're seeing, and you address it, we can start to do more for ourselves, and that will probably be even more prominent as we age.
That's going to be the way we get out of this conundrum. Technology is becoming more pervasive. It's becoming cheaper, easier to use. And for many patients, citizens, if you will, and their families and their care providers, being able to institute, with the help of professionals, care at home is going to be what I think saves the system. And we've put in place a number of programs in CIUSSS Centre-Ouest through the Jewish General over the last 18 months, which actually are pilot projects, but proof of principle, which shows that for the right patients with the right problems, we can care for people in their living rooms a lot better than we could in the hospital.
So can you give me some real examples, Dr. Rosenberg, of that? Because it makes sense. You know, we're clogging up the hospitals. We're waiting forever in emergencies. You're acknowledging that. And if we could do more at home, this would not be the ultimate solution, but it will certainly help out. So what are some real examples of how we could do something in our own living room?
Well, our hospital at home program actually began during the fifth wave of a COVID pandemic as a COVID at home program. At that point, we were seeing an increasing rise in the number of COVID patients coming to the emergency room. Many of them had to be admitted to receive oxygen, and that's all they really needed from us was oxygen. If we could figure out a way of keeping them at home and providing oxygen at home, we wouldn't admit them to the hospital. We wouldn't have been closing surgical beds, making our surgical wait times even worse. And so we instituted this program basically within 72 hours to treat appropriate COVID patients at home with oxygen at home, keeping them out of the hospital. And with that as a springboard, we've now got almost 30 different service lines. That is 30 different medical conditions that we're implementing in people's homes with the appropriate supports. To enable them to get the care they need, when they need it, where they need it. At the same time, we've set up a command center at the Jewish General, which is really the hub of our CIUSSS, that enables us to monitor people at home around the clock, 24 hours a day, 7 days a week, and we can actually monitor them better than we could if they were in the hospital. So I think this is really where healthcare is going. And the other point to make, which I think is extremely important, is that we've got to move from the era of healthcare to the era of health and wellness, because we're very good at looking after sick people. We're not so good at preventing illness. And if we could prevent illness upstream, we could mitigate a lot of the problems that we're now dealing with within the system today.
Dr. Rosenberg, I want to thank you. Some very encouraging words, and we have a long ways to go, but we really do appreciate you taking a little time here on Life Unrehearsed.
Thank you very much for the invitation. Have a great day.
Thank you. You too. That's Dr. Lawrence Rosenberg, President and CEO of CIUSSS West-Central Montreal and the author of Patients Matter Most, How Healthcare is Becoming Personal Again. All right, next up on Life Unrehearsed, next week is Children's Grief Awareness Day. Well, my previous partner in crime, Corey Sirota, is in studio with me. We're going to be talking about that.